Hi, today I'd like to take you through a basic hip exam so that you can feel empowered the next time you visit your clinician to discuss hip pain. With any basic hip exam, the clinician should first rule out more serious problems at the hip, which include a fracture. This usually occurs after a fall or trauma and results in the inability to bear weight or walk on the affected leg, and this would require an X-ray to rule out. Once this has been ruled out, a clinician could proceed by screening the low back. The low back often refers pain into the hip, tricking patients into thinking they have an issue with their hip when it's actually an issue at the low back. The clinician should have the patient arch backwards and look over each shoulder while asking the question, is the pain in the hip better, worse, or the same? And they should ask the same question as they have the patient bend forward at the back. If any of these back motions change the pain to the hip, it's possible that an issue at the low back is referring pain into the hip, making it seem like it's a hip problem when it's actually an issue at the low back. Once this has been ruled out, the clinician can proceed with the hip examination. If a person is under the age of 40 and they have pain in the hip, when they sit down in this position and press down on the leg, they may be suffering from hip impingement. Of course, this test could also be positive with a labral tear. However, a labral tear in the hip often occurs after a trauma, and it often results in clicking, catching, and giving way when a person is attempting to walk on level ground or up and down stairs. This usually requires an MRI to rule out. If a person doesn't have impingement or a labral tear, they may simply have a muscle strain. If the pain is recreated by raising the leg out in front, this could be an iliopsoas muscle strain. If the pain is recreated by raising the leg out to the side, this could be a strain to the TFL or the gluteus medius muscle. And if there's pain when pressing in on the side of the hip, this could be greater trochanteric bursitis, which is a common issue at the hip. Now, if a person is above the age of 50 and they have a toothache-like pain within the hip joint, which is usually worse in the mornings and with cold weather, they may be suffering from hip arthritis. The good news is that many of these conditions are treatable with conservative care, and they may respond to my hip pain protocol. Of course, you should consult your clinician before beginning any exercise or rehab program. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.